Okay. I want to give you some what we call good news, bad news. And the good news is that women who are heavy often have their estrogen decreased by the surgery. And there's good reasons that that can benefit you and maybe protect you long term from breast cancer or a heart attack or another blood clot. Okay? So let's go back for a second and remind you that we all make hormones. Women particularly make the high levels of estrogen. The heavier you are as a woman, the more estrogen is released from the ovaries, and the higher incidence of breast cancer, endometrial cancer, blood clots, stroke, and death that all go along with that increased weight and correlates with higher levels of estrogen. And the great news is after our surgery is that the estrogen level in our female patients drops quickly, precipitously back to normal. We think that's good. On the other hand, if you quit smoking, your long-term risks of emphysema, heart attack, lung cancer, bronchitis all go down, and that's good. I just wouldn't want to be near you when you quit smoking. In the same way, every 4 of our women after surgery, when their estrogen drops, they get emotional upset. They get anger, or sadness, or irritability, or grumpiness, or tearfulness, and it can be kind of rough. Not because the patient necessarily is having a bad event, oftentimes it's just the change in hormones. So when we see that, we want to remind you, just as we could use a nicotine patch to help our smokers get over the withdrawal from cigarettes, we might be able to help our patients who are having low estrogen get over that. Now, you can't have the estrogen patch because of your previous clot, but it's something to remember. If you're having surgery, our guys who are helping out, if you have it, it's nice to remember that sometimes an estrogen patch can help, just like a nicotine patch, so that the withdrawal, the estrogen as it declines, is not so rough. So you've had a couple of bumps?
Yeah.
Do you mind telling the group just so they can learn?